Hello, my name is Dr. Brian Raid and I'm a naturopathic doctor, and this is a video about trying to get the most accurate or reliable test results when testing for chronic infections like the Lyme disease causing bacteria, Borrelia burgdorferi, and co-infections like Babesia, Bartonella, Mycoplasma, and also different viruses as well like Epstein-Barr virus, HHV6, Coxsackie A and B viruses, etc. So there are several different labs out there that do run tests for these types of microbes, and they have different pros and cons to them, and that's a whole other topic, I guess, in and of itself. But what I've found is that when we're running something called an ELISpot test, which is a enzyme-linked immunospot test, is what that stands for. And we primarily use the lab Armin Labs, which is a lab based out of Germany. What we find is that when we do something called a provocation protocol, that seems to give us more reliable, useful test results. And I say that in part because once upon a time when we first started using this lab, we didn't do a provocation for patients, and we would still get positive tests, negative tests, and treat patients and then retest them and see that they're negative now that their symptoms are gone, things like that. And the testing seemed to be useful and reliable. But we did, over the course of time, myself and my colleagues here, like my residents and my other colleagues here that work with me, we sometimes found that with our patients, the results would be negative when we were kind of pretty surprised. We thought, you seem to have textbook Bartonellosis, or you have, a textbook history suggesting there's a persistent borreliosis / chronic Lyme disease, and yet the test results would be negative. And on rare occasion, patients would let us retest them after doing a provocation, and we would see that the results are now positive. So we did that with a few patients, not often, because the testing is way too expensive to be repeating and whatnot. But I saw that enough times where I thought, saw it a couple of times, and so I was like, well, maybe I'll start recommending a provocation prior to testing just in general. And lo and behold, when we started doing the provocations, it's been incredibly rare now that we get these kind of bewildering negative results to say, if a person who seems to have a textbook history suggesting that there's an infection, it's pretty much unheard of that we don't see some evidence of that infection now when we test. And then what we've also noticed is that the numbers that we get back when we do these tests seem to be quite a bit higher when we do the provocation. So when it comes to an ELISpot test, at least when it's run through Armin Labs, every result is given something called a sensitivity index, or an SI value. And the sensitivity index basically shows to what extent on the little petri dish where they ultimately do the lab assay, how many little spots popped up on that dish, and it's basically a measure of to what extent did the test kind of come back positive. And the cutoff point is a 3. So if you're at a 3 or higher, it's just considered a full positive. A 2 is considered to be a weak positive, and actually 2 or a 3 is a weak positive. Anything higher than a 3 is considered to be just a full positive. A 0 or a 1 is considered to be negative. And prior to doing provocations, what we found was that a lot of our patients, when they test positive, we'd see 2s and 3s or maybe a 4, but we'd really rarely see anything much higher than that, and that was fine. It was enough information to go on. But when we started doing the provocations, we started seeing numbers that we'd see 5s and 6s and 7s and 8s, and sometimes numbers that are even higher than that. And so it seemed to me that by doing the provocation, it was helping to what I presume is going on is that it was helping to rustle the bushes, so to speak, help to get those microbes out of hiding so that the immune system could actually react to them more easily, so that they could pick up that T cell activation, which is the type of immune system response that an ELISpot test is striving to test for. So doing a provocation, which is basically, in my practice at least, a combination of some fairly high dose antimicrobial herbs, and then also working with a biofilm disrupting formula, doing that for about a week leading up to the test has led to these seemingly more reflective, or I think accurate, results for our patients. So something to think about if you're a clinician recommending these types of tests, or if you're a patient, you may want to talk to your clinician about whether doing a provocation might be a beneficial thing for you to consider.